Okay, I think we can start the session. Yep. Okay, so hi everyone. Welcome to the fourth Founders Club session of Beyond HealthTech 2021. So my name is Joel and I'm your moderator for this afternoon session. So before we start, I would just like to quickly familiarize everyone with the Q&A options on AirMeet. So if you have any questions during the event, there are two ways you can raise them. So the first is that there is a raise hand function at the bottom of the screen, which will enable you to be invited onto the stage to ask your questions to our speaker directly. So if not, you can also type in your questions to the Q&A tab on the right column. So we'll be filtering through them, and the most relevant or upvoted ones will be answered first. So do take note that priority will be given to those who would like to come up on stage to ask a question, as we want to make this session as interactive as possible. So back to the main program. So we are very honored to have Mr. Julian Khoo, CEO and co-founder of Jagami, to join us today to share about his experience building his company from the ground up. So prior to Jagami, Julian was responsible for promoting life sciences investment with the Singapore Economic Development Board, and he actually started his career in innovation consulting for Fortune 500 firms at Synapse Product Development USA. So Julian holds an engineering degree from NUS and a certificate in technopreneurship from Stanford University as part of the NUS Overseas Colleges program. So I'm really happy to have you here with us. And so maybe just to start off, could you share about the founding history of Jagami and maybe what were the gaps that you sought to address with your company?
Thanks, Joel, and appreciate the warm welcome and the very interesting lineup that you have for this platform. So, in order to give you a background about Jagami and how we came to be, I think we have to kind of rewind a little bit to 2015, 2016. I'm not sure how many people remember some of the healthcare context within that time, but suffice to say, there were two things that were happening. Firstly, there was an acute shortage of hospital beds. And secondly, I think there was a very clear recognition that aging was round the corner and just about to really affect us as a nation in terms of as a macro trend. So that was the overarching context. But I think the interesting part was also the introduction of technology, technology companies, entrepreneurship. That was also the spark, perhaps, that catalyzed a lot of change during that time. It no longer became, it was no longer very odd to be an entrepreneur. I think it was still relatively odd at the time, but it started to become more acceptable. But for us, as a team of individuals who became founding members of the company, we had a very strong interest in trying to solve one problem, which is to help people to get access to quality healthcare at home. So that was the singular focus that we wanted to achieve in order to reduce hospital admissions, in order to reduce the what we perceived as a lack of empowerment of being in a nursing home or in a hospital. A little bit about, at least for context, that the team comprised of a nurse who also became my co-founder, still present today with us, and a doctor and a number of other individuals who were caregivers. They were in general business fields, but they were all caregivers for parents and loved ones. For myself, I did not have a very relevant background at all. I joked that the only thing I could do was maybe do PowerPoint slides. And I think that hopefully is an encouragement for everyone. If your only skill is to do PowerPoint, let not be an impediment for you to start a company. So for myself, I've been involved with some community based interactions with seniors, and I did get to see the difficulties that they faced, even with a very, very good healthcare system, right? So that was the context at the time and the context for the team, the people involved. And we really wanted to, as our name suggests, jaga people in their own homes so that they could do so in the freedom of their homes, their communities, their families. So that's a little bit of our.
Yeah, thank you so much for sharing on that. And I think definitely, I think these problems continue to remain today, right? And that's kind of why also MOH has that whole transformation in terms of from hospital to community, which is kind of what your company is also tapping on as well. But I guess like the next question that we want to follow up on is then, so how did y'all decide specifically in terms of using this technology of building a healthcare services marketplace to kind of address this need that you saw in terms of providing caregivers at home and really being able to meet this need, especially for patients in their post-hospital recovery journey?
That's a good point. That's a good question. I think we started from a very visible, very perceptible need and a relatively perceptible opportunity. The need being that there was a lack of, um, there's a service gap for people who needed responsive care outside of the institution. So when it comes to medical services, nursing services, care services, that was the most visible and what I might call somatic symptom you can observe. There's basically a lack of human help. There's obviously deeper issues, but that is one of the customer interviews. That's usually one of the very common denominators. We needed help. We needed somebody to be around. We needed someone trustworthy. We needed a quality healthcare provider. So that was the starting ground. It was very clear for us. In terms of the model, I would say that one of the opportunities that were presented to us was, firstly, there was untapped resource, namely healthcare professionals, paraprofessionals who were not in the formal workforce. So that became the nexus of what we wanted to harness and use technology to make more efficient, make the process of matching and resource management a lot more efficient. So in terms of our entire operating concept, we leverage very heavily humans, and human talent, healthcare professionals mainly, and we use technology to improve the deployment and the administration of it. Because as you know, a lot of healthcare workers have administration fatigue. After a long day on shift, a long day of home visits, you still have a lot of administration, do paperwork, and healthcare IT sometimes becomes an impediment rather than a tool or help. So we wanted to make technology work harder for both patients and for healthcare workers as well, so that healthcare workers could amplify their impact.
Yeah, I think especially what you mentioned about like being able to match kind of the need and that untapped resource, which I think in a way is also a microcosm of the Singapore story, right? We always say like, people are our resource, and in this case, like really it was the healthcare professionals that you were really tapping on. So I guess like from in 2015, I would say Jagami was quite a pioneer and quite revolutionary in the healthcare scene. But I think 5 years down the road, you've definitely had a lot of competitors come up as well. There's companies like HomeAge. They are kind of offering also a similar kind of healthcare service marketplace. So how have you kind of tried to differentiate yourself from these other community care agencies out there? Yeah.
Yeah, that's a great question. There are definitely a lot of different companies that are using technology now, even uh, incumbent companies or organizations like nursing homes, hospitals are also thinking about how to use technology. In fact, it wasn't too long ago that Sing Health had a program called Match a Nurse, about 2017, 2018, where they worked on that for 2 years, using a very similar concept of nurses in the community, and a platform to address that. So across the board, I think technology is a enabler. It's the tide, the rising tide that floats all boats. But I think each company needs to find their strength, their niche, and their area that they can continue to serve their customers effectively. And I think where we differentiate ourselves is that I think um, we overemphasize, overcompensate perhaps the uh, training and skill set of our people. So selection, we always emphasize that piece, and we overemphasize on partnerships. So while we started as and continue to be a technology enabled company, right? In a sense, through our foray in the market, we recognize uh, that we are not here to disrupt healthcare per se. We're here to disrupt the way perhaps healthcare is delivered, how patients interact with that, with healthcare services, their own health information, how healthcare workers interact with technology, but not so much to disrupt the good stuff, which is the fact that dedicated men and women put in hours, years of their life, professional careers to train and to get better. Um, and secondly, which is the professionalism, the skills piece, that part is ultimately is very, very core. It cannot dumb it down into a gig model too much. I mean, yes, you can improve processes, but by no means let's not consider them gig workers. These are professionals. These are people who've put in thousands of hours of work and degrees or diplomas. And the second part is um, uh, the trust. The trust part is super important. Not just so when I say trust, but it's partnerships with hospitals, partnerships with um, different healthcare institutions and organizations, because um, it's ironic, coming in someone fresh to healthcare, maybe more steeped in technology myself. I perhaps reached a point where I realized that our role as my role, or at least our role and myself in this role in this ecosystem is not so much to tell or prescribe how things are done, but really nudge improvements. And I realized the important parts are human factors, trust, professionalism, dedication, and technology should wrap around that, and not make the entire experience overly transactional. So I think differentiation wise, we will stay in between. We don't assume to be, uh, you know, uh, a, oversimplify the problem to a pure technology problem. Neither do we want to lean too far to the right, so to speak, whereby we want to keep everything the status quo. Overemphasize conservatism. That's neither the approach. I think we take a lot more of a balanced approach whereby both are needed, both technology improvements and also preserving and accentuating what's important in the current healthcare dynamic.
Yeah, I think yeah, really, what you mentioned, especially, and I kind of want to write on what you said as well. with respect to partnerships, right? Because you were talking about how really it's bringing through the human element and combining it with technology, but you also kind of have to deal with like all these different stakeholders. And I think as I was reading up as well, you talked about professionalism and kind of making sure that all the caregivers, nurses, doctors that come through, they're all also properly accredited to give the care that your patients deserve. So really, how do you actually work with all these stakeholders involved in this whole chronic care ecosystem? Because you also rightfully mentioned that, I mean, there are many hospitals who are also trying to get in on this market in a sense. Like I know, like, NUH is also piloting kind of like a telehealth and home visit system that was recently announced. And but you also work with hospitals to upskill your nurses and to make sure that they get the relevant continuing education points so that they can get their license. So like, how do you balance all of these interests?
It is very challenging to balance all the interests, to balance the human factors with efficiency, and things that are systems optimized. So I think one has to define certain things that are, immovable, certain principles that cannot be changed. And I think for us, that is talking about safety, dignity of patients and healthcare workers, right? And of course, quality of care, satisfaction of patients. These are things that outcomes that we will never move from, right? How we navigate around the processes, that one is all fair game. I mean, we've been very much involved in trying to change the way healthcare institutions exchange data with one another. Especially because, for example, uh, with the despite the very good efforts of the National Health Electronic Health Record, a lot of providers on the ground, right? Community healthcare organizations don't really have much access to that. So we almost have this very coveted holy grail, right, which comprises the treasure chest or whatever the patient's medical history is, and only the very, very selective group of institutions and healthcare professionals can access that. So I think looking at the changes that need to be made, there are a lot of changes. There are a lot of ways that safety, privacy have to be balanced with transdisciplinary nature of work, multidisciplinary nature of work, because I think healthcare workers today, healthcare professionals today recognize that it's not just about the medical, it's not just about the prescriptive nature of drugs and diagnostics and stuff like that make a difference to the patient. It's their lifestyle, it's their mental health, it's their social compact, and many other factors. But unfortunately, the health records almost entirely stewarded by people with an MCR number, right? Almost entirely. There's nothing wrong with that, but I suppose things need to evolve. And for us, using in our platform, health care assistant, PCA or HCA equivalent, can put in observations of a patient. They can take vital signs. Nurses can do the same, refer to those vital signs, conduct procedures, document that. Doctors can do the same, and all that kind of flows into a concerted and coherent view of the patient. And we hope that can be done not just within our little ecosystem, but the broader national ecosystem. So that's our hope and our wish, that would be a true networking that centers around the patient.
Yeah, I think really that kind of patient-centricness in terms of managing all that healthcare data, moving from institution to institution. It's kind of like an opportunity that your company is kind of identified as well, right? In terms of the role that you can play in that wider ecosystem. I was just thinking, with respect to opportunities and challenges that your company face, I would dare say that the COVID-19 pandemic was definitely something that probably disrupted every industry that we know, and not least the healthcare industry. So I actually wanted to ask, for the COVID-19 pandemic, actually, how did it affect the way that or did it affect the way you had to conduct your business? Because I know like there was all the restrictions and regulations, especially when it came down to the lockdown circuit breaker last year. And then until now, with all the heightened measures and everything that has been going on. So how has your company adapted to like the challenges it's presented? And were there any unique opportunities that you kind of were able to like glean and kind of capitalize on?
Yeah, I think every company and every person has been impacted by COVID in some way, and we are no exception. I would say the main way COVID has impacted us is that it has brought to the fore um, the need for healthcare to be decentralized, and for the management of care and the dispatching of resources to healthcare resources to be decentralized. Um, because the industrialized model of healthcare that we have seen since the 1800s, where hospitals started to emerge, in order to achieve economies of scale, in order to achieve better utilization of equipment, has entirely been turned. This model of hospitals has been somewhat turned on its head in the pandemic because of the potential of humans being proximate to one another, being itself a risk. So it's a bit of an irony to some extent. It's not anybody's fault. It's just the nature of a pandemic, that all the stuff that we've built, nursing homes for 200 people plus, up to 200 people, 300 people in a defined space, hospitals, thousands of beds together, the efficiencies that we long to create for patients has now become our Achilles heel. And that's what we observe also in the different clusters, and what we, at least for Dragami, we try to our very best to really come alongside our hospital partners, our healthcare partners, in order to stem any of such situations. So examples of that included responding to nursing homes when they needed to do testing, when they needed some additional help manpower-wise. For hospital staff, for example, the unimaginable happened with untoxing earlier in this year, April, and we very much collaborated very closely with some of their outpatient and community care cases, in order to ensure that vital lifeline would not be cut off. So I think for us, we really want to never waste a good crisis, and take the opportunity to harness the health system's invigorated state to do things differently, faster, better, right? So that's I would say that's our orientation. An example of that is how we were able to deploy clinics in very remote places with and without doctors. I think that was very interesting, at least the one of the most interesting opportunities that we've done so far, where we essentially ran hybrid clinics in work sites in very far-flung places like Tuas and Benoi Road, places you've never heard of, unless you want to take a staycation in the west of Singapore. And doing that for migrant workers and also, of course, some Singaporeans as well, testing, managing of patients in place. That is something that used to be like, oh, let's only send in the hospitals, let's only send in the doctors. But in this case, we did a combination where nurses packed medication with the guidance of doctors, went down on site, the doctors patched in through video, and it was not just Jagami doing that. MOM was doing that, right? Some of our other peers like Speed Dog and Homage were also doing similar things, and I think that's the power of regulatory how it's enlightenment to allow that to happen. Because prior to that, people will be, oh, the risk. Only think about the risk, right? Now, in this situation, inaction and slowness is the biggest risk, right? And our institutions, no matter how bright and shiny their exterior might be, no matter how many fancy diagnostic tools and people they are in, they're not going to be able to disassemble and go out to us. So we had to find a way in order to get there. And I thought that was very fascinating. That was a very fascinating time. And of course now, yeah, we do continue to do stuff that's relatively routine in that regard: testing, vaccination, the holy grail of our COVID response. So we continue to do that on an ongoing basis. But I think really it's nothing like a burning platform to get you dancing, right? So we've had a good dance so far. Yeah.
Yeah, I think definitely what you said is really how the local companies have really come together, even though you're all technically competitors. But I think, that COVID-19 pandemic has that odd way of making everyone unite as like a common group to really work together for our country in a way. Really like national day spirit, unity and all. Yeah.
Yeah.
Yeah, I think it's really been very good to really speak to you on all these topics, and I just want to bring our attention to some of the questions that we have from the floor. So I'll just show the question. So our first question is actually about your experience with whether you have any experience dealing with early dementia patients, and what are some of the current problems that are faced in terms of dealing with being able to deliver care to these patients.
Okay. Thanks, Jiahui, for the question. As you all know, I'm not a healthcare professional, but we as a team dealt with early dementia patients plenty of times. And what I do observe as a person by the wayside is that one of the big challenges, of course, is early identification of dementia, and also education of the family members, how to deal with the behavioral issues, and to mitigate the decline. Right. Of course, there are a few forms of dementia, but and the management would be quite specific to whatever form you're in and what stage you're in. But I think the big challenge is, how do you get identified early? How can you get treatment early if possible? And how do the families get rallied around? Because conceptually they may know, yeah, he or she has dementia, but practically it can be very hard to live with. And institutionalization can often be a hammer that falls down too quickly, as a means, as an end in itself. So I would say that would be at least my personal thoughts regarding early management of dementia.
Yeah, I think definitely in terms of I think especially for these mental health issues, I think there's also that stigma within the community in terms of early recognition, and I think especially because I would presume that Jagami really deals with a lot of elderly patients as well who may have like when you're actually treating them, like caring for them for another chronic disease, they may start to exhibit signs of dementia as well, and being able to cope with that kind of suddenly a new condition coming up can be quite challenging for the nurses that or the caregivers that are under your charge as well. So just like a short leader from that, maybe I could ask, how do you actually train or equip your healthcare professionals that are in your platform for these kind of situations? Is there like a certain program that you kind of get them to undertake, or some structured training that you carry out for your app?
Yeah, good question. So we've done that for dementia. We sent our some of the interested staff to attend courses that are sponsored by the Agency for Integrated Care, and it really helps them to empathize and deal with the behavioral issues, because a lot of it is um, in the early stages is behavioral in nature, and of course preventative in nature, where you can, by engaging through activities, through social means, having group sessions and so forth. um, so for us, I think that's where we have always been running many different courses on an interest basis. um, Sadly, I think one of the biggest challenges relating to dementia is um, that Singaporeans tend to rely on domestic workers, right? When the caregiving load gets too great. I'm all for globalization. I'm all for you know um, giving people the opportunity to work in Singapore, but I think the big challenge is that a lot of the care is being thrusted upon domestic workers, and they're not very prepared. So what you normally see in homes is you see seniors, you know, uh, you know, unengaged. Right, I'm talking about this is the 80% reality. You're watching television, which is the opium of our generation, and the healthcare, and then the foreign domestic worker will be on their phone, or of course doing the chores. And yeah, that's our dementia care, so to speak. And that's the unfortunate reality. Is there a way that uh, you know FDWs can be empowered further? Is there a way that they not just the most enlightened families could send their loved ones for daycare? I do not know. It's a very relatively complex issue, which taps on education, of public health education. It taps on uh, financing, healthcare financing. It taps on service providers. It taps on different methodologies that are going to be used. Um, but I think what's really important is the family ties, lah. The bond of that, and supporting families so that they can last the distance. I think there's really nothing wrong tapping on a foreign domestic worker, but sometimes when you have a hammer, everything looks like a nail. Like, oh, children, FDW, elderly, FDW, cleaning, FDW, dementia, FDW. It becomes a very misaligned, solution. And I have nothing against that, just to reiterate, but I think that's the reality that a lot of seniors are going to face.
Yeah, and I think you really like summed up the complexity of the whole issue, right? That it's really so multifaceted, and if we really try and just use a blunt solution without kind of looking into the root cause of the problem, we will just end up nowhere, and we won't have an effective kind of way to really target this need that's in our community. And I think like that's a very good way to tell our groups as well. I mean, that's the point of the hack, in that they are able to identify the root cause and be able to come up with feasible solutions that can be really delivered and commercialized in the real world. So I'm mindful of the time, but we have quite a few questions still streaming in. So I'm not sure if you mind staying for about maybe 10 to 15 minutes, and we can kind of round off the questions that are here, if that's okay.
I can do about 10 more minutes, right? Because I have some stuff I need to clear by 6. So
Yeah, sure. Yeah, thank you so much. Yeah. So we'll kind of prioritize the questions. So I guess the first question that I would like to tackle is actually this question about telemedicine. And because I understand that currently Jagami really focuses on the house visit and physical care. But that there's always that possible expansion point, right? In terms of telemedicine, in terms of doctors being able to deliver the consultations over phone or video call, etc. So has that been ever something that has been thought about?
Yes, we have done this, and this has been something that we are trying to continue to educate consumers about. So some of the, I think there are, Singaporeans are increasingly interested in this means and this way or method of getting care, but there sometimes is still a very strong draw to seeing a doctor in person, or going to a clinic, going to a polyclinic, going to a hospital. And I think for dementia, particularly for telemedicine versus dementia, there may be certain sets of evaluations or tests that may not be that easy to do through. But for chronic disease, usually first consult will be in person, second, third, fourth, and regular visits thereafter can be done through teleconsults. So I think even as a tool, telemedicine also has to be catered for different.
Yeah, I think it's really about the personalization to each kind of disease, right? As you mentioned, dementia as compared to treatment of like some other chronic diseases, such as maybe diabetes, would definitely be very different in terms of the approach. And so I guess like in that spirit of expansion as well, like in terms of seeking different channels aside from physical visits and telemedicine. We actually have one more question that I'd like to cover, which is from Monica. So Monica asks, how did Jagami first gain its credibility and manpower in a sense, and how would you overcome the difficulty of further expansion in a sense? Maybe like if it could be like outside of Singapore or anything like that.
This is a wise question. The short answer is that we had a very good clinical founder and then co-founder, and that's important. So if your solution is relying on certain a high level of clinical practice, you need a very strong practitioner to be the anchor. For example, if you want to start an oncology app, you might want to make sure you have a pretty strong oncology anchor doctor who's on board or in your advisory board or something like that, right? So same thing for us. We started with nursing, we started with care. I think we were very privileged to have my co-founder Ling, who was a very strong nurse, right? Both in ICU setting and also in the home care setting, which is like being very strong at cycling and swimming, right? It's almost like biathlon kind of cross training. It's very important. So I think for us we had that strong player, and I think that really helped the credibility piece. However, I didn't want to advise, because I think or not advise, but to share, because somebody asked about health tech as well. Not all health tech should be tied to a practitioner role, right, or to a practitioner model. So in the absence or in lieu of having a very strong nurse or doctor, or having a model that is very practitioner centric, one can also rely on research data, AI, data models that can be put to AI. So these are all your diagnostic, chat bots, your Babylon AI and stuff like that. And of course, there are other diagnostic tools that can be, that relate to health tech. So I just wanted to caveat here that while it's very important if you're doing a practitioner centric model, if you're going through a more data centric or research, when I say data, I mean, of course, research validated data. That's a very different orthogonal direction from this. So you will need a much stronger data set. You need a much stronger advisory and research panel. It's a different kettle of fish in that regard lah. But yes, it is super important to have that credibility either way. So you don't want to. So you're right. This is why I say it's a very wise question, because whether you're using your solution runs on data or runs on individual practitioners, credibility, it is underlying credibility. Underlying it is trust. So it's very important for any operation and expansion, of course. Yeah, but on the point of expansion, just to maybe end off here, while you might have very credible doctors, very credible nurses, very credible data, the challenge you will find going overseas is that there's also regulations and regulators and interest groups you need to work around. So, example, in Indonesia, you can't start practicing as a Singapore doctor because they have a lot of regulatory hurdles in the name of safety, in the name of nationalism and whatever not. So that's one thing you will have to realize, whether you're going through a more data-driven one or more practitioner-driven model. Regulatory, differences will very often, be a very strong.
Yeah, I think thank you so much, Julia, for kind of that closing as well, in terms of how our teams can look at in terms of how to design their business model, especially in the initial stage of building trust and credibility and moving out from national to kind of a global expansion as well. So really want to thank you for spending the time with us, and wishing you a good evening and a good weekend ahead. And I want to thank our audience here for tuning in as well. Thank you for joining us for this Founders Club, and stay tuned for more of our programs that we'll have in the future. Yeah, thank you so much.
Thanks.
Thank you.
Bye.
Bye.